Hello and welcome to my channel. I'm Gretchen with from Healing from Within with Cancer. Today we're going to talk about the process that I went through, which I'm sure a lot of you have gone through after that colonoscopy, to get the results of what was going on inside of you and having to process this information and taking that next step with a surgeon and other methods of treating the cancer that you have. And mine, once again, was stage 3 colorectal cancer. I was diagnosed after the stage 3 part, should I say, was diagnosed after I had had my colonoscopy and a pathology report, like everybody has, they go through. My problem started at that point because I was told by this doctor that now I have to go to a surgeon to speak to them about how I was going to have this tumor removed that was blocking the colon and right at the rectum. So this tumor was right there in not such a great operable area to have. And so I had to go through, to a surgeon, and then he had indicated, and then you want to obviously make an appointment with an oncologist to, talk to them about the methods that they would use for treating this cancer. So I said, okay, but there's definitely going to be an uphill fight from here on out with the way that I'm going to proceed with it. A little background information. I was in the health and wellness field for 13 years, and I would have the pleasure and opportunity to work with a lot of integrative doctors that did things a little bit different than quote unquote modern medicine. And I was enlightened on a lot of different things that you can choose to do to heal your body. So I knew going into this a little bit more than the average person that's diagnosed, and I knew options that were available to me through, working with all these wonderful physicians that, choose a different path. A lot of them are East meets West. So if you have never heard that term before, it's where we take, Western medicine and integrate it with Eastern medicine and collaborate the two together and come up with a nice end result. I was choosing to go that route. That was immediately after I was diagnosed, and I was told after the pathology report, which had come back very quickly, that it was stage 3 colorectal cancer and that I had to have it removed. My process immediately kicked in with my thinking and saying, all right, we're going to deal with this, but we're going to deal with it my way. That was where the challenge came in with the doctors that I was dealing with. And my hair is going crazy, so I apologize for keep moving it all over the place. But anyway, it's humid out, and it just tried curling it today, but it didn't want to work. Getting back to where this journey has taken me is that I went to the first surgeon because I really didn't know where to start. I was in foreign territory of, colon surgeons. So I did take the recommendation of this, the doctor that did the colonoscopy, and I went to this female doctor, and she had an intern in her office, and where I went from there just kind of spiraled a little bit out of control, and I'm here to share that with you. So anyway, it was the day of the meeting with this surgeon, and she came into the room just for a second to introduce herself, but then she left this intern in the room to show me the results and the camera images that were taken during the colonoscopy and where the tumor was at and so on and so forth. And I said, he goes, well, how we would treat this is, being that this is a tumor, we would do some radiation beforehand to reduce the size of the tumor. And I had asked the gentleman that was showing me these pictures, I said, well, a lot of radiation is not good for your body. Why would you choose that route? And he says, well, I come from China and there's a lot of radiation in the air, and look at me, I'm fine. Well, that wasn't the answer that I was looking for. That didn't fly with me. So immediately I'm thinking, okay, well, that was kind of like off the wall answer, but I'll wait till the surgeon comes in, and I'm not going to pass judgment at this point. So the surgeon comes in, and she was very pleasant and explained this is the procedure that she was going to take. And it was, first and foremost, she wanted to have me do a couple sessions of radiation to shrink the tumor. And then we would proceed with the surgery once it was in the size range that she felt comfortable with operating on. And then it would be followed up by more radiation and chemotherapy after the surgery. Well, I got that information, and she wanted me to meet with an oncologist. And I said, well, I don't believe in chemo and radiation as the answer to heal my body, because I'm now putting in more toxins into the body to heal it. This is just not making sense to me. So she then, of course, became very standoffish with that comment that I made, and said, I understand what you're choosing to do, but that's not going to help you. And I thought, all right. Well, what other alternatives do you have to present to me? Because that seems to be the common denominator here, is that you go, this is what you go through because that's what everybody tells you to do. But you got to give me choices, because that's not the choice that I want. And so she had indicated that there was a holistic oncologist. Well, that just completely threw me for a loop, because oncology and holistic do not go together at all. So I was not understanding that term, and I said, please explain to me what that means, because if you're doing things holistically, that's natural. Oncology is through chemo and radiation, and that's not holistic. So how do we combine the two together? That's where she had indicated, well, it's less invasive. We don't produce as much chemo. We don't fill your body with as much chemo and radiation as we would another patient. Well, honestly, once again, that still made no sense to me whatsoever. So I took the information and I said, I'm going to have to think about this. And then that's where she became very curt with me and said, you have to get this out of you. And I said, let me ask you something. How long have I had this tumor inside of me? It just didn't pop out of nowhere. And she said, well, the normal tumors in the colon are slow growing, and that they could be anywhere up to 10 years of growth. Okay, so this has been growing inside of me for 10 years. If I take a month to do a little bit more research and get a second and third opinion, which that's what I was intending to do, I'm not going to have any issues here. This is a very slow growing cancer, so I don't need to make abrupt decisions. And this is my life we're talking about. So I think that I have that choice to make, that who's going to do what to me and how it's going to be done. So thank you very much. And I left her office and I started asking around. I had talked to a number of colleagues that I had worked with that had had surgeries before, and if they had physicians that they highly recommended. And it was nice, because I had actually one of the techs that were in my department, he was very good friends with a surgeon that he was in the Marines with, I believe. That's how it went. Or that he knew him, that he was in the Marines, something with the Marines. Anyway, long story short was he was a surgeon that was in the Marines at one point. So he gave me his name and I met with him, and he looked through my test results and basically had said the same exact thing to me in that meeting. He was very, very stern and very tall and very intimidating, to say the least. But later on, I'll tell you how that all turned out. And but it was definitely something that now I had some questions prepared because there was a couple weeks in between these visits, and so I had said to this particular surgeon, let me ask you this. And just as a side note, this was truly the only time that I had shed a tear since being told that dreaded cancer was inside my body from the first doctor that had died, that had given me the test results from my CT scan. So I proceeded to ask him if, in fact, once he were to do this barbaric, as far as I'm concerned, procedures after the surgery, and also a colostomy bag, because that was highly recommended in this surgery, that I was going to be the same person sitting in front of him that day that I would be in 6 months after this chemo and radiation. And he sat back in his chair and he said, "No, I cannot answer that, and I can honestly tell you, no, you will not." And I said, because I've read the stories about the chemo brain. I've read the stories about side effects from the radiation. This is a very delicate area that you're working with. There's a lot of things that could go wrong, a lot of infections that can happen. Why are you choosing to do these things? And I feel torture myself that much more than everything else that's going on inside of my body. None of this was making any sense to me. None. Zero. Why are we doing these types of things? So he had said, well, what is a way that you want to do things? And so I said, what I would like you to do is remove the tumor, no colostomy bag, put me back together, and I will take it from there. Well, he proceeded to ask me why. And I said, well, when somebody breaks a leg, do we take off the leg and mend it, put it on a shelf, and wait 6 or 8 months and then put it back on the person? And he said, well, of course not. We never do that. And I said, well, that's what you're doing to the inside of my colon. You're basically taking it apart wherever the tumor is, and you're cutting that out, and then you're diverting the colon to this foreign object, which is a bag that I would carry on the side of me, and then you're going to allow wherever you did the surgery that you cut to my colon and rectum, you want that to heal. But then in 6 to 8 months, we're going to put this back together where my body has been completely taken apart and doesn't know what to do or how to do it or how to function. And now you want it to function again. That just doesn't make sense to me either, because our bodies are meant to heal themselves, regardless if we're cutting on the inside or we're got to cut on the outside, that we need to have stitches on. So he said, well, what do you want me to do? And I said, I want you to do the surgery. I want you to cut out the tumor and anything that looks like it's cancer that's inside of me, and put me back together, and I will heal myself. No colostomy bag, no chemo, no radiation. We're not going to shrink the tumor. We're just going to go in, take the bull by the horns, get it out, and I will take it from there. He did not like that. But he did say, let me think about this. I said, okay, fine. And then I went on. I was referred to a top colorectal surgeon in my area. He was the director of that area of expertise at a major hospital here. And I was able to meet with him after I had met with this other doctor. And I went into his office, and that's where he said, I know why you're here, because a friend, of course, had was able to squeeze me in to get me an appointment with him. And he said, I know why you're here. Your friend has told my wife about, the things that you want to do, but I'm here to tell you what you're going to do. And then he proceeded to tell me the same procedure that everybody else was telling me. We're going to do a little radiation beforehand, then we're going to do the surgery. We're going to put a colostomy bag on you, and then you're going to heal, and then you're going to come back, and we're going to put you back together again and hope, keeping fingers crossed, that everything works for you 6 to 9 months later, whatever his term was. And I said, okay, thank you for that bit of information, but this is what I want done. And he looked at me and he said, absolutely not. You have a death wish. It doesn't work that way. And I said, okay, well, thank you very much for your time. I do not have a death wish. And I believe that you were very rude to me to say the things that you did. And I'm done with this appointment. Thank you. And I walked out. Well, at that point, I really didn't know where I was going or what I was doing, with surgeons, because really my only hope was this second surgeon that said that he would think about what I wanted to do. And so I did get a call. I just had to take a step back because all of this information was just overwhelming to me. And I'm thankful that the second surgeon had taken a little bit of time, because now this was starting to become very overwhelming to me. And I did a lot of praying. I went to church many times because there was a church that was literally like right around the corner from where I was working. So I would go there on my lunch hour and I would ask for guidance from God. And I am very spiritual. And I said, you know the right thing to do for me. You know how I feel about these things. And to please guide me. Please help me with a surgeon that is going to do the right thing. That we're not just going to just cut me open and put me back together and hope for the best, because that's not the way that we do things. And it was one day I was sitting there doing my work in the office, and I got the call from the second doctor, and he said, I've really taken a look at your CT scan. This is, a very risky surgery because of where the tumor was and where it was located between the colon and the rectum. And there's just not a whole lot of room, to be cutting away at somebody and putting them back together the way that I wanted to be. And I said, okay, so what are my choices? And he said, well, I'm not 100% for what you're talking about, but I know that you've done enough research and you have enough knowledge that if this is what you want done, then I will do the surgery. Well, as far as I'm concerned, the universe, God, everybody answered my prayers right there. And this sense of relief came over me because I finally had a surgeon listening to me and what I wanted to do with my body. So we made all of the appointments to do the follow, or the whatever it is that you do before you go into surgery, all the testing that you have to do. I don't even recall what it is. I kind of put on the blinders. I have to admit there's a lot of things that I do block out, because I wanted to stay in a positive energy. And when negative things came at me, those were things that I just didn't want to talk about or discuss. I just kind of went through the motions because that was what I needed to do. So I apologize if I can't give you a lot of that information, but I just know that I went for pre-op testing and blood work and so on and so forth. And getting ready for that day of surgery. And I was working full time. There was a lot of stress within the work environment. And I was really going downhill at this point. I was not eating much of anything besides eating crackers, a few here and there, and drinking water because nothing was working. I was in excruciating pain at this point, not understanding what was going on within my body, because everybody kept telling me about the tumor and that they got to get it out, but nobody was telling me about all of these horrible effects that I was having on my body. My lower back was in excruciating pain. I was getting, it was just, my mindset was not there. I was very foggy because I was in so much pain. My surgeon did want to prescribe me, painkillers, but I didn't believe in those. So I did go the alternative way and sought a medical marijuana card, and immediately went down that road, and, did more research on that as well. And we can get into that in another video regarding medical marijuana and the benefits of it with cancer patients. But I just needed something because I was out of my mind. I honestly, I still think back to that time and cannot understand how I was getting up every single morning, running my daughter over, to school, doing a full day's worth of work, 8 hours, running around in the field, and then coming home, fixing her dinner, and then literally collapsing on the sofa at night because I was in so much pain and not being able to function. So it was just a very difficult time in my life, and there's not a lot of things that I want to say that I can remember that were good, because all I remember is just a lot of pain. I went to an acupuncturist that also was a spiritual healer. Now, at this point, I'm researching all kinds of supplements and doing as much as I can to know how to heal my body from within. And so I was on the phone with anybody that would talk to me, literally every supplement company out there that would talk to me. I'm trying to find as much research as I can on alternative ways of healing with cancer. And there wasn't a lot of information on the internet. And now I became very frustrated. So I reached out to supplement companies and being able to talk to nutraceuticals that were so kind to me and spent the time. One, actually, that was out of, I believe it's Alberta, Canada. The gentleman literally spent an hour and a half with me and just educated me on super enzymes and what my body was going through at this particular time and why, and what I needed to do to get these enzymes in my body because they were so depleted. And I didn't even know this. I didn't even know anything about any of this stuff. But boy, I'll tell you, I was nothing but SpongeBob. I was absorbing as much information and being that sponge as I possibly could, because I was looking for answers that there was not a lot out there. And I had even called on a couple people that I knew, and they were very skeptical in my approach. These were doctors, integrative doctors, that they were very, very skeptical on my approach. They're like, wow, that's pretty radical. And, you might want to reconsider this. No, I was set that I was going to heal myself. And so I did a lot of praying. What I didn't realize is I was manifesting all of these things that I wanted, because I was, my convictions were so strong that I was going to heal myself, and stayed in that positive mindset. And that's something that my surgeon later on had told me he was just amazed with. And if I can give you one piece of advice, if you're going through this, if you've gone through this, if you're, have a loved one that's going through this, the mindset is a very, very powerful thing. And when we hear that term cancer, immediately we go to depression, right? Because that's doom and gloom, because that's all we really know. But it doesn't have to be that way. And I've heard stories where it changed people's lives for the better because they learned to appreciate the things that they had. And I've always appreciated the things that I've had. I was not going anywhere. I have 4 children, and I was not going to leave this earth by any way, shape, or form just because there was this cancer inside of me. I have way too much life to live that this was just not going to happen to me. So for me, it was about research. Every spare minute that I had, I spent calling people, talking to people, educating myself, letting them educate me on what, I can do to heal my body, to get it ready for surgery, pre-op, post-op, all of these things. And so that's where I have a book of notes of everything that I did and why and how. and staying focused on everything that I needed to do to make sure that my body was going to heal. Now, I've always been a decent eater, but this is where I really, really tried tweaking my diet big time, even though I was on basically crackers and water. I knew that the Mediterranean diet has always been very healthy. Not that I follow a strict diet, because I don't. I just try to eat good foods. But I did more research into that, as well as, some others, and realized that was the route I was going to take, once I got out of the surgery and started healing, because it just brought in all of the nutrients that you need, for your body. Plus, it's just very, very healthy way of eating. And actually, I like the food too, so that kind of helped too. Uh, the one thing that was going to be very difficult for me, I was a chocoholic. I loved my chocolate. Well, what does cancer feed on? Sugar, 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 sugar. So I knew all sugars had to go out of my diet. I would say that that's probably harder than anything that I ever had to do. But what I did is I kind of tricked my mind, and anytime that I was looking at that candy bar, that Reese's peanut butter cup, or whatever it was that was laying there on the table, I said, that's poison. That is poison to you. You can't have that because you're poisoning your body. So it was kind of a mind over matter thing that I did with myself. I know it's not easy to do, but I just set that tone, and I said no more. And actually, before my surgery, I wasn't eating any chocolate because I couldn't eat anything. Nothing was working for me. Well, there is a procedure that, because I was losing so much weight, that my surgeon wanted me to do with some kind of supplement drink. And I said, well, right now I'm not doing any sugars, and my body's just going to become polluted with all of this stuff. But, being that I need to have the strength, I guess I'll follow some of these things. And lo and behold, I went to the store, I got whatever they needed, or no, excuse me, I went to the doctor's office because they had the supplements there for me, this supplemental drink, should I say, that they wanted me to drink X amount of days before my surgery. Well, I did the first day. It was horrible. It tasted terrible, but I said, okay. I wasn't feeling good. By the second day, I was like keeling over with stomach pain. The third day, I said, I'm not doing this. I called the doctor. I let him know. I was vomiting. It was just horrible. So I said, I'm not doing this. And we stopped it. Well, I decided to finally put on my glasses and read the ingredients. And it was basically nothing but sugar. Well, when your body withdraws from sugar and then you introduce all of this sugar and carbs into it, you are going to have a reaction. And that was my reaction, was vomiting. So, leading up to that surgery, I just cut out everything and decided, now, once again, the body's going to heal itself. But I did start introducing supplements for a little period of time, but then of course they told me that I wasn't allowed to do any of the supplements days before the surgery, so I had to cut all that out. And I wasn't happy about that. But I kind of went the course of, all right, I'm going to meet you a little bit here because you are doing this surgery for me. So, day of surgery, and I'm ready to go. I just wanted all of this done. I couldn't take it anymore. I was ready to lose my mind with the pain that I was going through. So in my next episode, I will tell you about, I shouldn't say episode, but it's, the episode of my life. But the next chapter of it was the surgery, how I dealt with it, what was going on, all the gruesome details. Because, people don't want to talk about this. And I think people need to know that you're not alone. It's, the dignity that we once had, the vanity that we once had, it kind of all goes out the window when you have these kind of surgeries. It's just in the worst spot in the world, and nobody wants to talk about it, and it's pretty bad. But we'll get into that the next one. And if you do have any questions, please feel free to reach out to me. Have comment. You can send me an email. I'm more than happy to discuss things, with you and giving you, my roadmap on the things that I did, uh, moving up to the surgery, the places that I went to, and to find things that were going to help me out, and take it down that road. But I can say that in closing, that when I went to this acupuncturist, he was also a spiritual healer. And he took one look at me when I walked into the office and he said, "You will not have cancer after your surgery." And you know why I know that? Is because I've never met you before, but I could tell that you had a different mindset than most people do going into this. How he knew that, I don't know. He's been on many TV shows. Dr. Nini, I know he was on Dr. Oz, I believe Oprah, and he just happens to live in the area that I'm from. And one of my friends was able to get an appointment with him because she knew him, because he was helping when her daughters were into a car accident, and he went and prayed over them. And lo and behold, these two young girls had survived this horrific car accident, and she attributes that all to his healing powers that he has. And so I was willing to give anything a shot, anything at that point. And so I'm more than happy to, answer any questions when it comes to that as well. But once again, positive mindset, knowing that you can handle this. You're a fighter, you're a warrior, whatever you want to call yourself, survivor, you're going to do it. And that's where things, had taken a whole different twist for me through the surgery and then through recovery. But look forward to talking about that in the next video. But I hope that you like what we've discussed so far. And if you do, I would love for you to like and subscribe to my channel. And we'll go down this together. And I want to be here to give you some inspiration on knowing that you're not alone. There's a lot of people out there that are dealing with the same thing that I dealt with, and looking for an answer that isn't what all the doctors are talking to us about, and giving you hope. So look forward to the next video, and I wish you a great day. Bye.